Hello everyone, my name is Jez McCole. I'm a GP in Sheffield, and I'm going to show you how a few protocols that we've built at Primary Care Pathways could support your hyperkalemia safeguarding work. So this is the first protocol I'm going to show you. So I'm going to launch a patient called 18 EdiTest in our system. I'm going to add a consultation. And immediately we get a warning. So the system has identified that this patient has had recent, that is within the last 7 days, severe hyperkalemia with a potassium of over 6.5. The advice in this situation is to admit the patient immediately, even if you are suspecting a false positive. So click OK as we continue to add our consultation. Now, the second bit of this protocol is now appearing in the zap box in the corner. So we see severe hyperkalemia is noted. If I hover over that, it tells me a little bit more about the situation. 30th of September, severe hyperkalemia with a potassium of 6.7. It's also telling me that there's no noted acute kidney injury in this situation. It's also telling me that the patient is not on any medications of concern when associated with hyperkalemia. So the record's already been analysed for these particular parameters. If we look at the medication list, we can see that that's broadly correct. So the next patient I want to show you is EdiTest patient 5. And again, we can see when we open the record that there is a hyperkalemia alert. And again, this is an in-your-face alert. Last 7 days, again, mild hyperkalemia with a value of between 5.5 and 5.9. We're being advised to think about signs of acute kidney injury or if they may be acutely unwell. A little bit of background as to what's expected of us in this situation: to repeat the bloods within the next 3 days, review the medications, make a plan for the next week or so. If we click OK with this, we'll see again that we have a mild hyperkalemia information alert in the zap box. 30th of September, serum potassium was actually 5.8. No AKI was noted, but they are on the following medications of concern in association with hyperkalemia: non-steroidals, triple exclamation mark, and some opioid analgesia. So these are identified as being potentially problematic with hyperkalemia. Show you what happens if we've added a consultation for this patient. The pop-up fatigue that we're all experiencing more and more these days is something that we want to try and address with these alerts as well. So we've added a consultation of gobbledygook, and I'm going to save that consultation now. And there's another pop-up underneath. Have we dealt with this raised potassium alert? By clicking yes, a couple of codes are entered onto the records that are appropriate in this situation and which also prevent the big pop-ups from appearing. If we click no, then the brightly coloured pop-up will carry on appearing for the next 7 days. We'll choose yes. Now we will only see the mild hyperkalemia issue in the zap box. We won't be presented with the colourful pop-up alert. And so finally, I'm going to show you another test patient who also has hyperkalemia, but in this case, the patient has hyperkalemia and there are clues in the record that they have also got some acute illness at the same time. So we can see that the alert now says recent moderate hyperkalemia, potassium between 6 and 6.4 within the last 7 days. And we're going to get more information in the zap box shortly. But there are now clues to coexisting acute illness. And here the protocol has examined a number of concepts within the record looking for high acute illness indicators like the news scores, sepsis indicators, and in this case the issue of antibiotics within the last 3 days. So because of these clues, it's just giving that extra bump of caution, really. So the recommendation may well be that we need to admit in this situation you're being informed of that straight away. If we click OK, we have the moderate hyperkalemia pop-up information panel, where we see the latest potassium is 6.3, no acute kidney injury, but antibiotics within the last 7 days has been noted. Also that they're on hypoglycemic drugs and non-steroidal anti-inflammatories. So hopefully you'll find these alerts useful, and hopefully they won't appear unless they're necessary. Thanks very much.